Hello guys, good morning. Welcome back to my YouTube channel. This is Miss Henderson. So today I am going to be reading some Prometric exam questions with you. I hope these questions can help you to pass your Prometric test. So that being said, let's dive into the video. So I'm going to be reading off my computer here. I have a few questions here. So the first question we have here, guys, states that when assisting a client in learning how to use a cane, the nurse's aide stands A, approximately 2 feet directly behind the client, B, about 1 foot from the client's weak side, C, about 1 foot from the client's strong side, D, slightly behind the client on the client's weak side. So the correct answer is D, as in David, slightly behind the client on the client's weak side. Question number 2 states, when working with a client who has a urinary retention, the nurse aide can expect that the client will A, urinate large volume, B, be unable to urinate, C, urinate frequently, D, be incontinent of urine. So when a patient has urinary retention, the correct answer will be B, as in boy, be unable to urinate. That's the correct answer for question number 2. Question number 3 states, aging related to hearing changes result in older clients gradually losing their ability to hear. A, high-pitched song, B, low-pitched song, C, song levels, D, faint song. So the correct answer for question number 3 will be high-pitched song. That's the correct answer for question number 3. Question number 4 states, the best way to safely identify your patient is by A, asking his name. Question number 5, as I read, the proper medical abbreviation for before meal is A, PC, B, BID, C, AC, D, TID. So the correct answer for question number 5 is AC, before meal. That will be the correct answer. Question number 6 states, a client diagnosed with hypertension will most likely have history of A, low blood pressure, B, high blood pressure, C, low blood sugar, D, high blood sugar. So the correct answer is high blood pressure. A client diagnosed with hypertension, the correct medical term is high blood pressure. Question number 7. A patient who has difficulty chewing or swallowing will need what type of diet? A, clear liquid, B, low residue, C, puree diet, D, mechanical soft. So the correct answer for question number 7 will be D, mechanical soft diets. Question number 8 states, an elderly resident with Alzheimer's disease cannot find her room. How can the nurse's aide help the client feel more independent? A, tell her to stay in the room. B, have her roommate secretly watch her. C, place a familiar object on the client's door. D, write the room number on a piece of paper. So the correct answer for this question will be C, place a familiar object on the client's door. That's the correct answer. Question number 9. How often should a patient intake and output be recorded? A, once each shift, B, twice a day, C, every 4 hours, D, every 12 hours. So the correct answer for this question will be once every shift. So how often should a patient's intake and output records be totaled? Once each shift. That's the correct answer for this question.